Welcome back. Well, they're thin, beautiful, and require little or no prep work to put on your teeth. They're called Thin Prepless veneers, and they're perfect for people looking for a great smile without all the pain, expense, and time it takes to prepare your teeth. San Diego dentist Dr. David Hornbrook joining us once again this morning. Good morning. Welcome back.
Well, thank you. It's always good to be here.
All right, so you've been using these on your patients for the last 4 years with some unbelievable results.
Right. We've had incredible results, and it's technology that's just changed. We've done veneers using state-of-the-art materials for almost 20 years in our practice, but new technology and the way things are being made now, I mean, it's incredible.
Yeah, and you could really get the same look you're saying with these Prepless veneers as compared to some of the other products that take the prep work to put on.
Oh, exactly. I mean, certainly it's specific for a certain patient. Not every single case is an indication for Thins, but we're getting the same results. Aesthetics, not looking bulky, they're natural, they're beautiful.
Okay, and I believe we have some of the before and after pictures that we can show people, and really, I mean, there's all sorts of problems that people would have that they need the veneers, and
yeah.
In this before shot, obviously, this person has some gaps in their teeth.
Right, and this is ideal because they need more tooth on their existing tooth. So we're adding versus taking away and adding. And this is, spaces, what we call diastemas, that's an ideal indication for this. And we're going to change this kid's life. I mean, it's unbelievable.
Wow, and the after shot is just night and day.
Right, and this shot was taken the day we placed them. So we don't use anesthetic, we're not taking anything off the tooth, so it's conservative. Theoretically it's reversible, but this kid's never going to want his original smile back.
Yeah, yeah, and is this the same?
This is the same case,
patient?
just from a side view, where you can see the dramatic results with the spacing.
Unreal. I mean, talk about changing someone's smile and really changing their life, their self-esteem, and the way that, they feel about themselves.
Oh, yeah. I mean, the smile is so important. Again, another one like this, where this is an educated woman that deals with people in the public all the time, and she looks in the mirror, doesn't feel good about the way she smiles, and so she doesn't smile as much, and now she loves her smile. She's smiling. Other people can feel the warmth, and it's life-changing. It really is.
And there was, some discoloration in her teeth. Obviously, her new veneers didn't have that at all.
Exactly.
Pearly whites. Talk about people who would be good candidates for Prepless veneers.
Yeah, I mean, there's a lot of great candidates that we can utilize for. Again, it's not a case for everyone. But, we're looking at discolored teeth, mild discoloration, where we're just covering them up. Spaces between teeth, as we saw. Short teeth, so we can lengthen, chips on edges. Anytime that we're adding versus taking away and having to add. Minimal overlap. Obviously, Noah, that little dog with Darlene, would not be an ideal candidate.
Right.
Minimal overlap.
A little bit of an overbite.
And the other thing, it's all ages. In the past, we didn't put veneers on kids, where they chip their tooth, or a teenager, and we'd do bonding, or we'd put a crown that didn't look so natural. Now we can go in and very conservatively replace that broken tooth or missing tooth that again, it's very conservative and very aesthetic.
And really, like you said, it's about adding and not taking away. Those are the best candidates.
Exactly. I mean, if a patient has a tooth that's way out, obviously we're not going to add to something that's already out too far. We'd have to prepare the tooth and bring that back, and we do that. But if we need to add, this is ideal. And this material, the Thins, I mean, it's so natural, and it's strong, and it's kind to the other teeth when you're biting and chewing. I mean, it's cool technology.
So if someone has poor periodontal health, not necessarily a good candidate as well.
I mean, there are some contraindications. One would be severe crowding. We do what we call instant orthodontics. Instead of waiting the 2 years, we can literally give you a perfect smile in 2 weeks. But we're going to take tooth away to add veneers. Also, so that would be a contraindication. The other would be periodontal disease or gum disease. I mean, if you don't have healthy gums, get that taken care of, and then we'll talk about a beautiful, beautiful new smile.
Right. And talk about the reactions that you get, after.
Right.
We saw the after shots, but you hear from your patients. I mean, right. I can't imagine. I'm sure a lot of people get emotional.
Oh, all the time. We hand them a mirror at the end of the procedure, and they're staring, and of course tears start rolling down their face, and I'm thinking, God, I hope it's tears of joy, and not that they don't like their new smile.
Right, right.
But again, it's really the first time they've looked in the mirror and they felt good about themselves. And as a dentist, we're frequently what I call bearers of bad news, right? You have a cavity, we give you a shot, and we place a restoration or a filling. Now we're bearers of good news. Where people now are sending me thank you notes and sending me emails and just thanking me for what I can do to enhance their life.
And the great thing about the Prepless veneers is, it's so much less you know, not only the time that people have to come in, but, you know, to be under the drill, and, you know,
Right.
it's so much easier nowadays with this new technology. All right, if people want to get a hold of you, where can they call?
Well, they can certainly call my office, and I'm here in San Diego, 463-7797, or they can go to my website. For those that are on Facebook, I have the Hornbrook Center of Dentistry has a Facebook page that actually has a lot of recent before and afters we did, and they can get educated. And if they have any question, they can email me or call and just see if they're a candidate, or maybe they're going to their own dentist and that wasn't suggested to them, and they just have some questions. I mean, I'm certainly available.
Yeah, and you know, we talked about this before, but you know, not all cosmetic dentists created equal. You're actually a fellow with the, is it the American
Academy of Cosmetic Dentistry. It's the largest
dentistry.
organization of aesthetic and cosmetic restorative dentists in the world. And you're right. And you know, I think you need to make sure you know your dentist is educated, know what they're doing, and can show you before and afters that they've done.
All right, Dr. David Hornbrook,
Greg,
thank you so much.
It's always a pleasure.
All right, great information. And as always, you can go to our website, san diego6.com, for more information. Up next,